We're back with Mark Steiners of Entertainment Tonight with Michael Fleeman of People Magazine and Dr. Neil Martin, Professor and Chief of Neurosurgery at UCLA Medical Center. I asked the doctor during the break if there's pain involved when we have a brain injury, and you told me that you sometimes operate on the brain without anesthesia.
In some cases, when there's a tumor in a critical location, we have to test the function of the brain continuously, and the patient has to be awake to respond verbally to questions or to move an arm or a hand. So in some cases, yes, the patient is actually awake during the surgery. The brain doesn't have nerve fibers, so they don't feel any work done in the brain.
Therefore, can we guess maybe she had no pain?
If she had a hemorrhage in the brain, she may or may not have had pain initially, but progression of bleeding in the brain tissue itself may not be associated with severe pain. Generally, as it gets worse, there will be an increasing headache, and really that's one of the signs that indicates that you've got to get to medical attention right away.
And you gather from the fact that she was talking and apparently kidding around after this that it might have been something pre or it could have been post.
She may have had some sort of minor trigger that caused her to fall, and the fall may not have been the primary problem, although there's a chance that it was.
An autopsy would tell us that?
Well, the CT scan that certainly was done will give some indication as to what the underlying problem was, and the autopsy may answer further questions.
One more thing I'd like you to show us, the normal brain. And I understand this is what is taught to medical students?
This is what our pathologists use to teach anatomy of the brain to the medical students. So this is a preserved slice of a brain, and these are the fluid cavities within the brain, and the infolding of the gyruses on the surface of the brain are illustrated there.
This is a healthy brain.
This is a healthy brain.